video, you will witness the step-by-step essential newborn care protocol developed by the Department of Health. This protocol adopts international evidence-based standards set by the World Health Organization. They directly address the Millennium Development Goal of the reducing child mortality. The Philippines is among 42 countries that accounts for 90% of deaths among children below 5 years of age globally. Studies have shown that 70% of newborn deaths may be averted during labor, delivery, and immediately postpartum. In short, it is in the first few seconds and minutes of life that every newborn Filipino is given the chance to survive and to have a better life. During those first moments in the arms of a mother, during the first embrace, sa unang yakap. Let's now start with the preparation. Lay out 3 pairs of surgical gloves, 2 of which will be used by the obstetrician, and the remaining pair for the pediatrician. 2 warm blankets, a bonnet, cord care set, erythromycin, vitamin K, and hepatitis B shot.
For hand washing, open the sink, wet hands under running water, pump liquid soap on the palm, and start rubbing both hands. Palm to the back of each hand, palm to palm with interlaced fingers. Twist each fingers. Reach interdigital spaces. And rub the wrist. Rinse thoroughly with the clean water. Dry hand using clean towel or tissue paper. Hand washing with soap removes germs from hand. This also helps to prevent infection. Place the first pair of gloves on your non-dominant hand. Be careful not to touch the sterile area. With the help of non-dominant hand, slide other pair of gloves on the dominant hand. Gloving helps keep our hands clean and lessen chance of getting germs that can make us sick.
During the first 3 minutes within birth, here are the procedures prescribed by the Essential Newborn Care Protocol.
Baby's out, 11:58.
Once the baby is delivered from the perineum, call out the time of the birth and the sex of the newborn.
Using a clean, dry cloth, thoroughly dry the baby, wiping the face, eyes, head, front and back, arms and legs, and dry the baby for at least 30 seconds. This will stimulate the baby to breathe. Do not wipe off the vernix to provide a natural protective cover for the baby. Do not wash the baby within the first 6 hours. Washing could lead to hypothermia and infection. Do a rapid assessment while drying the baby.
Initiate skin-to-skin contact by placing the baby prone on the mother's breast. Place the bonnet on the newborn's head and use the second linen to cover the baby's back. Make sure you cover the baby's back to make the baby feel warm and comfortable.
For proper identification, attach and secure name tag on the lower leg or upper foot of the baby. You will see mother's name, date and time of delivery, gender, baby's name, and the name of the physician. It is necessary to prevent serious errors and prevent harm to the newborn.
The next step is removing the first pair of gloves prior to handling of the cord. This helps to reduce the infection before the cord clamping and cutting. Do not cut the cord immediately. Allow cord pulsation to stop without milking the cord. Clamp the cord at 2 cm from the base of the umbilicus. Apply the second clamp at 5 cm from the base of the umbilicus. Then, cut the cord. Benefits of proper cord clamping: waiting for 1 to 3 minutes or until the cord pulsation have stopped will prevent anemia and protects preterm for intraventricular hemorrhages.
Inject 10 IU of oxytocin into the mother's arm to prevent uterine atony. It helps to prevent also heavy bleeding known as postpartum hemorrhage. Delivery of the entire placenta is vital to your health after giving birth. Retained placenta can cause bleeding and other unwanted side effects. Check how heavy her bleeding and examine her perineum, lower vagina, and vulva for fears. Clean the mother and keep her comfortable after delivery the placenta.
Non-separation of newborn from the mother for early breastfeeding. So breastfeeding provides all the nutrients that a baby needs for the first 6 months of life and development. So it helps to protect against infection and it promotes emotional relationship or bonding between the infant and the mother.
At about 30 minutes to an hour after birth, the baby will start licking, rooting, and tonguing movement, cues that the newborn is ready to breastfeed. Encourage the mother to nudge her newborn toward the breast to seek out the nipple. Counsel the positioning and attachment. After the baby complete the first breastfeed and detach from the breast while the newborn is with the mother, carry out the eye care.
Newborn receive erythromycin eye ointment after birth to prevent pink eye in the first month of life. We will put our erythromycin eye ointment to the baby's eye and inner to outer canthus. This is to protect babies from getting bacterial eye infection that can occur during birth. If it's untreated, this infection can cause serious problems including blindness.
I will show you how vitamin K and the hepatitis B vaccine were administered. First, we need to inject 1 mg of vitamin K through intramuscular into the left anterior vastus lateralis of the newborn. Its purpose is to help the newborn for the blood clotting. And next, we need 0.5 ml of hepatitis B vaccine and we need to inject it through intramuscular into the right lateral anterior vastus lateralis of the newborn. Its purpose is to protect against the hepatitis B.
Let the infant remain in the mother's arm as she recovers from giving birth. The newborn stays with the mother as she is brought to a room or the ward. The baby may be washed after at least 6 hours. The Global Infant and Young Child Feeding Strategies recommends giving the baby nothing but the breast milk for 6 months. After 6 months of exclusive breastfeeding, child can continue to breastfeed in addition to other food up to 2 years old of age or beyond. To sustain new life for those first few precious moments in the life of a newborn, in the life-giving embrace of the mother. Unang yakap, yakap ng ina, yakap ng buhay.